Good morning.
Good morning.
Happy
Happy
Monday,
Monday.
everyone. So do you want to talk about why you couldn't spin around in your chair? What happened this weekend?
Oh, I guess so. So we went floating. It was beautiful, very peaceful, relaxing. We get out, we're getting ready to load the kayaks. I didn't realize the kayak was full of water, so I just picked it up and I did something to my back. So it's been very hurting for all week. And I went to the chiropractor today and it still hurts, but it's gonna be okay.
Yeah, you're not a complainer, so it must be bad.
Yeah, I no, I don't usually take anything, and I've been taking ibuprofen and Tylenol. So
Yeah. Anyway, so Amy is taking a break on the chair turnaround for now, if you guys are
yeah, I can't do all that.
Okay, so today we are talking about the different enrollment periods, whether you're new to Medicare or it's sometime during the year and you want to change your plan. There's a lot of different types of enrollment periods. We have a newer agent, and she was even confused researching everything because it is confusing. So this is something that we help people with. We have different resources. So,
Yeah, and another resource that we provide are Medicare 101s, and this is just about a half hour to 45-minute presentation. Either we can do them one-on-one with a person at their home, at our office, at a restaurant, whatever they're comfortable with. We do workshops where there's usually around 5 to 10 people, and we present. Or a Zoom, you can hop on one of our Zooms, and it's a virtual, and we'll just go over the different parts of Medicare, what they cover, what they don't cover, what your options are in terms of picking up the 20% that Medicare doesn't cover. And then also during that workshop, we do go over the enrollment periods, which can be confusing. So today we're going to get into the enrollment periods a little bit more.
so take it away, Amy.
Alrighty. So the first one we're going to talk about is IEP. Um, IEP is your initial enrollment period, and that's going to be the 3 months before you turn 65, the month you turn 65, and 3 months after. Now, if you're already collecting Social Security, you do not have to apply for Medicare. You're going to be automatically enrolled. If you're going to continue working and you're 65 and you have group employer coverage, you can wait to apply for Medicare. Um, if you are not collecting Social Security at 65 and you want to get enrolled into Medicare, then this is a perfect time for you to do that. 3 months before you turn 65, the month you turn 65, or 3 months after.
Mhm.
Okay, the next one is called annual enrollment period, and this is every year, October 15th through December 7th. This is when the TVs get flooded with advertisements. You're going to get tons of mail, way too many phone calls. And this is a time where you can add, drop, or switch your Medicare Advantage plan or your prescription drug coverage. And it's always good every year to go over your drugs and doctors and medications for your plans just to see. Plans change every year, and it's important just to make sure it's still the best plan to fit your individual needs.
Mhm. And that's a service you get with us when you have an agent. It's free. You can sit down with us at the office, or we can just do a virtual call to go over your notice of change that you get in the mail from your carrier, to see if it's still the best plan for you. Maybe if medications have changed or your health, there might be a better plan that we should put you in for the next year. And sometimes now it's called open enrollment period. They like to change the name of this. We went to Medicare.gov today just to make sure everything was still the exact same. And we still call it AEP, annual enrollment period. That's a very common name, but on the Medicare.gov website, now they're calling it open enrollment period. So yeah, just they like to keep people on their toes. So the next one is the Medicare supplement open enrollment period. We'll go through this one quickly because really it just means it's a time where you have no underwriting required. It does last for 6 months, but if your Part B starts, you don't want to wait 6 months to start doing things because you'll be penalized if you don't have drug coverage. So really what this means is there's a 6 month window where you get guaranteed issue into Medicare supplements. They can't rate you up because of your health. The next one is the Medicare Advantage open enrollment period. That's the first quarter of every year, January 1st through March 31st. If you're in a Medicare Advantage plan, you can make a change at that time. It's a one-time change. So let's say you made a change during the annual enrollment period to a new company. You tried it out for a month and during the first quarter, you're not happy with it, you could switch back to that old plan you were on, or you can make a change to a different carrier at that time. There's also special enrollment periods. These are on average, they last around 2 months. So these are when you retire, or your spouse retires and you lose their creditable employer group coverage. If you move to a different county, there's different plans available, so you can make a change at that time. If you ever qualify for extra help, if your income dips below that certain level, you have a special enrollment period. If you're diagnosed with a chronic health condition, and then also we've realized FEMA declares natural disasters a lot. So for example, for flooding, we got really bad hail this year in Missouri. So they did open up a special enrollment period if you were affected by that natural disaster. There's also the general enrollment period. That's January 1st through March 31st. And this first eligible for Medicare if you miss that initial enrollment period. This is your chance to sign up for a plan. But usually you will have a late enrollment penalty if you don't qualify for a special enrollment period. I think that's about it for today. If you want to leave a comment with any extra additional questions, we'd be happy to respond to you. There's a lot of unique situations. That's why it's so important to also sit down one-on-one, because everyone is unique. Your situation is different. And there is some flexibility, as you saw with the different enrollment periods. Some people think they're stuck during the year in a certain plan, but contact us and maybe there is some wiggle room to get you out of your plan or make a change.
Alrighty, and don't forget to walk your mile today. Walking 1 mile a day will reduce your chance of dementia by 50%. So get out there, get moving, get that blood flowing, and have a great day
All right. Have a great Monday.
next week.